In this lesson, we will be talking about gestation and break it down. So let's first talk about the basics. So gestation is going to refer to the time period of carrying the pregnancy. This is when we ask somebody, how many weeks are you? And usually a pregnancy is going to be 40 weeks. That's when we say that's as long as it should go. So there's a few different ways that we can calculate this. So to figure out how long or how far along someone is in their gestation. One way is to do the Nagel's rule. And it's a little math equation that you can use to estimate delivery. So this math equation is going to work best for somebody and be most accurate for someone that has a regular, normal 28-day cycle. So to do this math equation, you're going to ask somebody when their last menstrual period was, the first day of that. We are going to subtract 3 months, add 7 days, and add 1 year. So for an example, let's say somebody's last menstrual period, they tell you, was December 1 of 2018. So this patient, we have to now subtract our 3 months, which is going to put us at September 1st, 2018. Now we have to add our 7 days, so that is September 8th of 2018. And then we have to add a year, so it's going to be September 8th, 2019. So someone that has a last menstrual period starting December 1st is going to be estimated to be due September 8th of 2019, which will give us that 40-week gestation. So let's say you have a patient that maybe can't tell you when her last menstrual period is, or she doesn't have a regular 28-day cycle, because remember, that's how it's going to be most accurate. For this patient, we can do an ultrasound measurement to estimate that. So for this, the patient comes in and has an ultrasound. So over here, you'll see we measure the crown to rump. So the head to the bottom, basically, of the embryo. And that measurement is going to give us an idea on how far along she is in gestation. So for this, though, it can be off 7 to 10 days, and that's just because it depends when it implanted, when implantation occurred, and of course, maybe how the embryo is positioned. But that is another good way. So an ultrasound measurement or doing Nagel's rule. So let's compare the two ways with Nagel's rule and with the ultrasound to find out the different gestational ways, just to see the breakdown. So for Nagel's rule, we have to interview the patient and ask when that last menstrual cycle began. We have to subtract 3 months, add 7 days, and add a year. And that is going to give us an idea for gestation. Now keep in mind that if this patient had a last menstrual cycle of January, so let's say January 1 of 2019. When you subtract the 3 months, you got to go backwards, right? So you also have to take that year with you. So whatever minus the 3 months, it's going to be 2018, and then later you'll add the year back. Otherwise, you're going to end up with somebody that's been pregnant for like 2 years, which isn't going to be right. So just make sure you watch that, because that can get tricky on a test that you want to, if it's a January or February, even March baby, you want to take that year all the way back with you. Sometimes students forget to do that, and then it'll make the pregnancy far longer than what it really is, or what it should be. So our other way is ultrasound. So for this is the patient that maybe doesn't have a regular cycle or doesn't know when her last menstrual period was. So this patient, we want to lay her comfortably on the bed with a slight incline. Now that's important because we don't want the patient flat on her back ever during pregnancy, because it can affect how the blood pressure is returned and have her blood pressure drop, which won't be good. So it's a slight incline, and then the ultrasound's done, and we're going to measure that crown to rump on that fetus or embryo. Sometimes this ultrasound can be external or internal. So the internal is more invasive. That's our transvaginal ultrasound. So internal is the transvaginal, and the reason why usually it's a transvaginal is because the patient's usually early on in gestation. So that's their first prenatal appointment between that 6 to 11 week mark. And it's so small that the transvaginal is going to be how we get the best image because that uterus is still kind of in the pelvis and hasn't popped out. If the patient's coming in for later in pregnancy for a check and she's further along in that second trimester, then an external would work. There's really not a lot of medical management that's necessary for this patient. It's a lot of education piece and just making her comfortable. So we want to get her comfortable in positioning for ultrasound, remember that incline. And then if we're doing a transvaginal, as you see here, just kind of explaining what we're doing before any hands touch. Then we want to give education on calculating the due date. So we want to know that last menstrual period and let her know why we need to know that. And then education on pregnancy and when to return for a prenatal appointment. So remember, prenatal appointments are super important during pregnancy. And then just giving education on things like the importance of making sure she's taking a prenatal vitamin now that she's pregnant to get her body what she needs. So pregnancy and gestation deal with human development. So that's one of our nursing concepts. And then, of course, reproduction because she's pregnant. Let's just review our key points so that we can review. So our length of pregnancy is going to be one of our key points. So how many weeks is that patient? So remember, 40 weeks is our length of gestation. So we want to know how many weeks she is in that. Nagel's rule is one way we can measure for gestation or to figure out the gestational age and how far they are along in that. So for that, remember, we're going to take our last menstrual period. We're going to subtract 3 months and then add 7 days and then add a year. And then the last way is our ultrasound. So this is our measurement from crown to rump, so our head to our tail, crown to rump measurement to estimate the due date. So make sure you check out the resources that are attached to this and practice doing the Nagel's rule because those are usually definitely a test question. Now go out and be your best selves today, and as always, happy nursing.